Welcome.
Thank you so much. Well, congratulations on a fantastic conference. I hope that you're having trouble containing your pride because you absolutely deserve it. It has just been a phenomenal 2 days, and I'm so humbled and grateful to have this opportunity to be a part of it. Hera, thank you for reaching out to me and including me. The auspicious and renowned leadership that has been present and presenting from across the globe the last couple of days. I'm just so honored to be a part of it. And I'm so excited to be talking to you about something that I'm extremely passionate about: patient experience, translating caring theory into our practice each day. And as I toured the Al Musa Hospital a couple of days ago, I saw your compassion and your competence in every unit that I visited. The compassion and competence that you showed one another and that translated to your patients. I know it's important to you, and I'm so excited to have this discussion with you. And so why is it important to us? It's part of our journey to become a high reliability organization. We want to consistently give safe, high-quality, patient-centered care. And how do we do that? Part of it is creating an exceptional patient experience every time. And that is undergirded by developing caring relationships with our patients so that our patients know that we care about them we care as much about them as people as we care for them as our patients. I had the privilege of working with Dr. Kristen Swanson, a world-renowned caring theorist. She was at the University of North Carolina in 2008 when I joined the organization. Her caring theory really became what undergirded our work that we wanted to do in elevating our patient experience. We found that we had opportunities to improve, and we wanted to ensure that it was evidence-based and grounded in caring theory. So a wonderful academic and hospital partnership began. Swanson defines nursing as a caring way of caring is a nurturing way of relating to a valued other to whom one feels a sense of personal responsibility and commitment. And I think about that is really a wonderful definition of relationship-based care. And I tell you, Bonnie, what comes to my mind when I see that is the Daisy statue and that intimate relationship that it signifies between a nurse and their patients. So how do we build that caring relationship? Swanson identified 5 caring processes that when we demonstrate them and integrate them into our care, they promote the well-being of our patients. The first are knowing and being with. When we work to ensure that we're knowing our patients as individuals, that we're focusing on really having a presence with them, our patients see us as compassionate caregivers. And then enabling and doing for, as we work to prepare our patients to care for themselves, as we bring to our care, our clinical competence. Our patients see us as competent caregivers, and running through all of that is maintaining belief to promote the well-being of our patients. Swanson stated that the essence of caring is maintaining belief in the personhood of another and their ability to achieve their maximum state of well-being. It is anchored in knowing, conveyed through being with, and enacted through doing for and enabling. So I want us to look a little more closely at each one of these caring processes. Knowing a patient is really trying to understand an event as it has meaning in the life of that patient. We never want to assume, and I saw your busy OR schedule for Saturday, that our first patient of the day and the last patient of the day, that their perceptions around their experience are anything alike, even though they may be having very similar procedures. So how do we do that? Swanson's theory proposes that we integrate these subdimensional behaviors that make visible our caring to our patients. So we always want to make sure that we're centering on the patient, that we're seeking cues about their verbal and nonverbal presentation, their level of anxiety, fear, or their comfort with what's happening. We want to make sure that we're avoiding assumptions and that we're assessing them thoroughly. And when we do that, we're exercising that caring process of knowing, and our patients see us as compassionate caregivers. Being with is not only being physically present with our patients, but being emotionally present with them as well. And I've been a nurse 41 years, and there is more technology in a patient's room than there has ever been in any time in my history. And so many areas across the world are having trouble with nurses walking into a patient's room, and they're addressing the monitor and the beeping pumps, and they're never really taking the time to have the discipline of focusing on the patient. Each time we enter a patient's room, we want to make sure that we are focused on them, that we're being fully present, that we're conveying our availability, that we're letting them know we're going to endure with them through whatever this clinical condition or pain that they're experiencing is, allowing them to share their feelings and developing that caring, connected relationship and conveying that compassion. Knowing and being with convey the caring attribute of compassion. And these subdimensional behaviors integrated in our daily practice make that visible to each of our patients. Doing for is doing what our patients would do for themselves if they were able, but they don't have the clinical competence and capability that you share. And so you bring that clinical competence and you offer that as caring to your patients. So all those things that you do to make sure that you're administering your medication safely, delivering complex dressing changes and IV therapy. As you perform those skillfully, as you comfort and anticipate your patients' needs, as you protect them from harm while they're hospitalized and preserve their dignity, you're showing that caring process of doing for, and our patients see us as competent caregivers when we do so. Enabling is facilitating the passage of one through life events and transitions. I simply think of it in our hospital as enabling our patients to care for themselves when they go home and they're no longer in our care. All that we do in terms of our patient education, informing, explaining, validating, and making sure that they understand the education that we've given, helping them to develop and generate alternatives that may need to be different in their life now that they have this clinical condition, that is enabling our patients and helping them to achieve greater independence. So the caring process of doing for and enabling conveys that caring attribute of clinical competence, and we can integrate it into our practice much more richly as we focus on these subdimensional behaviors that convey the caring process of competence. Maintaining belief is that sustaining faith in another's capacity to get through an event or transition and face a life with a meaningful future. You know, when our patients are admitted to us and they're diagnosed with cancer or diabetes or peripheral vascular disease, their life is maybe very different from this point forward than what it was. And that is a significant moment for them. And so as nurses, we have the opportunity to give them hope, to be hope-filled in our conversations, to be realistic in terms of optimism about the changes that may have to be made, but also ensuring them that we're going to go the distance with them through whatever clinical condition it is that they face. Maintaining belief conveys both compassion and competence and truly promotes the well-being of our patients. Each of these 5 caring processes are so important in making our caring visible to our patients as we integrate them into our daily practice. And they promote and inspire the well-being of our patients. Swanson's theory proposes that as our patients experience these caring processes, it facilitates a positive sentiment and response that promotes their well-being. When we take the time to show our patients that we want to know them as a patient and an individual and as a person, they feel understood. When they see us having the discipline to be focused on them when we're in the room, they feel valued. When we do for them what they're not able to do for themselves, they feel safe and comforted and protected. As we enable them to care for themselves when they're no longer with us, they feel increasingly capable and able to live a more independent existence when they are discharged from our facilities. And then above all, when we help them to maintain hope, maintain belief, they feel hopeful. And all of this together promotes their well-being. So how do we begin to translate caring theory into our everyday clinical practice? At UNC, these are the nursing interventions that we chose to ensure very deliberately that we were integrating the caring processes. Now, you may have different labels or slightly different definitions, but in all of our nursing interventions, they give us the opportunity to demonstrate these caring processes to our patients. I saw so much around intentional rounding when I toured the other day, and at each time we are involved in a patient's room with intentional rounding, it truly gives us the opportunity to focus and demonstrate each one of those caring processes, knowing them as an individual, where they are in their care, doing for them the things that they cannot do for themselves, being present and focused with them, and educating them as they begin to care for themselves. One of the things that I was so excited as I rounded on your facility is that I saw not only your frontline nurses are rounding, but I also saw that your nurse leaders are rounding as well. And together we're all validating that the care that we want to deliver to our patients is happening every day. Another aspect of rounding that we added at UNC was, you can't provide an excellent patient experience without nursing, but it also takes much more than nursing. So we integrated with our support partners. So our managers of nutrition and food service and housekeeping also rounded with our managers on our patients so that we get a collective sense of knowing and how we're doing on the care of our patients so that we're delivering an exceptional experience. Healthcare is complex, and explaining it to our patients can be very challenging. And so we've adopted this approach of words and ways that work. And there are very specific things that we need to communicate to our patients when they're admitted or discharged or going to surgery or returning. But we always want to make sure that our communication is authentic and that it is, there are many times it's more than the words, it's the ways that we interact with our patients. A caring touch, being creative in the way that we communicate, and I know that you're doing that here, even using art and drawing. And as I was rounding, I saw how you've developed this tool to help your nurses who do not speak Arabic to be able to speak Arabic phonetically. And this is, I will tell you, the only Arabic that I can speak. But it is such a wonderful example of words and ways that work to help us to know our patients better. You're doing this so beautifully here. Narrating care is simply telling our patients what we're doing, why we're doing it, and while we're doing it. We want to care out loud so that our patients understand what's happening in each therapeutic treatment, and also that we have that opportunity to teach our patients while we're interacting with them and delivering care. And I think many, many people across the world know how compassionate nurses are as a profession. But I think as we narrate our care, we give them the opportunity to also see how incredibly smart and intelligent you are and how complex your job is as you integrate so many various aspects of care to deliver the very best in care. No passing zone. When you think about it, when a patient uses their call light, what they're telling you is, I need you to come be with me. They're looking for that caring process of being with. It may be physical assistance, it may be emotional support, it may be questions that need to be answered. But as we each take the responsibility of being a first responder to every time a call light goes off, our patients see our commitment to responsiveness and to being with them. And that is how we integrate that element into our clinical practice. Moments of caring. You know, every time we have an interaction with our patient, there's always should be a moment of caring. But one of the things that we found very valuable was expecting our nurses once each shift for 3 to 5 minutes to pull up a chair and sit by the side of their patient and to speak with them about whatever is important for them for that day. It may be the conversation is sparked by a photo of family or a significant place that's in the room. It may be that they're concerned about the surgical procedure or their treatment and they want to have that opportunity to discuss that with you. Or it may be just the disappointment that they feel because this is the second time that they've been hospitalized and missed a family gathering. All these are ways that we can connect with our patients in moments of caring to show that we want to know them, that we're committed to being with them, and to help them to maintain belief while they're struggling with this clinical condition and their illness. Patient-engaged bedside report. I was so glad to hear that you are committed to this. I'm ashamed to tell you, but I'm going to be really honest. When I was a young nurse, change of shift report happened in the break room with coffee, donuts, and a tape recorder. There wasn't even another nurse in the room, much less a patient. But as you do patient-engaged bedside report and you commit to that, what you're really doing is bringing the whole team together, able to demonstrate each one of the caring processes as you work to know that patient better, as you're together with them as a team, as you do for them and enable them to participate in their own care. It becomes a very powerful way of communicating caring to our patients. Each one of these nursing practice interventions are linked to one of the Swanson caring processes. And I suspect if you have other specific interventions in your organization, you can take a moment and look and see which caring processes do we have the opportunity to communicate more effectively to our patients as we interact and care for them during each of our nursing interventions. So how do we know how well we're doing as we try to communicate caring? In the United States, the Centers for Medicare and Medicaid require that we use the HCAP survey. And each HCAP survey has a very specific list of questions that one of the things that we've done is gone back and linked each one of those questions to the Swanson caring process, so that as we begin to talk about our patient experience scores, we begin to be able to translate that into what is it telling us about the caring process? What is the voice of our patient in terms of telling us, you need to know me more? I need you to be more responsive and be with me. Or I didn't feel like I was ready to go home and take care of myself. And so I did a quick look because I know that you don't have to use HCAPS, but you use Press Ganey here. And so this is just a quick cursory alignment of some of those questions that your patients are asked relative to their experience in your hospital. And I think it can be a great opportunity to begin to talk with each other and to talk with our teams about what is the voice of our patient telling us around knowing and being with. Where do we have that opportunity to do better? 2 minutes left, please. I'll be finished just very quickly. And then doing for and enabling. That's our opportunity to make sure that we're preparing our patients to care for themselves. And that question overall of likelihood to recommend an overall rating of well-being is not something that you can individually work on an initiative. It's about how well we do all of our caring together to promote the well-being of our patient. And I know that's what you're focused on because as I toured, I saw well-being in your hospital's vision, that we're focused on well-being and our patients want more than the relief of suffering. They want to return to their maximum state of well-being. I'll say, as I toured your facility in this hospital that's only been around for a short number of years relatively, it reminded me of this quote of Florence Nightingale: "Never lose an opportunity of urging a practical beginning, however small, for it is wonderful how often in such matters, the mustard seed germinates and roots itself. And that is certainly what's happened here at Al Musa. Thank you for allowing me to be a part of this conference and speak with you today.
Thank you very much. Thank you.